Recent trends in the healthcare industry have accelerated change and consolidation, with an increase of independent physicians either moving into large hospital systems or independent practices joining network groups. We're here at one such practice, that of independent physicians who chose to join the largest independent physician-led practice group in the region. We're right here in Fremont, Ohio, at the practice of Dr. Jennifer Homan and Dr. Mary Bauer. They're now a part of Northern Ohio Medical Specialists, or NOMS Healthcare. I'm Sherry McLean, and I'm joined by Dr. Lou Rulofsky, President and CEO of Northern Ohio Medical Specialists. Thank you so much for joining us. What exactly is NOMS Healthcare, and how does it work for physician members?
Well, NOMS Healthcare is a physician-owned, physician-led group of healthcare providers. They came together about 15 years ago. I'm a physician, in fact. Would you like to see what we're all about?
Absolutely. Why would a physician want to join NOMS Healthcare?
To retain their clinical autonomy. It's the doctor's practice still. We just remove the administrative burden.
So how different is that than being a part of a large hospital system?
It's really the opposite, because in a hospital system, you're an employee. You're essentially owned by the hospital. In our practice, you retain your own practice. It's your practice. You have your own clinical autonomy. But you just get the benefits of all the administrative cost efficiencies and economies of scale.
Are there any other benefits? Because you did mention those, so that would be advantageous to joining NOMS?
Absolutely. The reduction in things like malpractice insurance costs, the appeals process that we go through, most other physicians never even get to that. We go after every healthcare dollar that's out there that those physicians have earned.
So there's a cost savings. That's excellent, and that's something everybody's reaching for. But it also sounds like there's time savings as well.
Absolutely, and the time savings is so critical, because then you can practice medicine. You can practice medicine the way you were taught to practice medicine without having to worry about the business side, but we do that for you.
Dr. Homan, what made you decide to go from being an independent physician to joining the NOMS Healthcare family?
Dr. Bauer and I wanted to be able to really focus on the practice of medicine and focus less on paperwork and regulation. We wanted improved efficiencies and economies of scale. We were looking for help with things like human resources and information technology, help with contracting and billing, and we were able to get that when we joined NOMS. You go to medical school and learn how to take care of people. You don't learn anything about running a small business. And so trying to do that in your evenings and weekends and lunch hours is very complicated. This way, we don't have to do any of those things. We let our team help us do that. Financially, we're better off, but that also allows us the opportunity to spend more time at home with our families. So my lifestyle is better than it was before as well.
Dr. Rulofsky, let's focus on the business side of things. If a physician is interested in joining NOMS Healthcare, how would they do that?
Yeah, all they have to do is call us. I'll sit down with them and have a physician-to-physician talk with them. And we'll hook them up with the CFO in our group and the administrative resources that we have to answer any questions that they have.
Talk about your guarantee.
Yeah, we have different models within NOMS Healthcare that they can work with us on. We even have a model that will guarantee their safety, security, income for a period of time, so that they don't have to worry about anything. We would sit down and talk about what their practice is like right now, and project out what it might look like in NOMS Healthcare. Things like comparing notes on IT, EMRs, legal costs, accounting costs, billing systems, things like that. Things that they're doing now that we would pick up the administrative burden on, that we often see a lot of synergies, cost reductions, and we do it very well.
We want to thank Lou Rulofsky, President and CEO of Northern Ohio Medical Specialists, and I'm Sherry McLean. Are you an independent physician who would like to retain your clinical autonomy and compete better? To get the administrative help of the largest independent physician-led practice group in the region, call NOMS Healthcare for a physician-to-physician consultation.